Now this compound, let's see if we can use our rules again. Now what do we see in this compound? Well, actually, this is the same compound we saw a few slides back. So is it hydrophilic or hydrophobic? Well, again, let's look at our classic signs. We do see polar covalent bonds. Again, we have nitrogen and carbon here. We have nitrogen and hydrogen. We have oxygen. We have fluorine. So we do have polar covalent bonds, but we also have a lot of non-polar covalent bonds. Again, we have a lot of carbon-carbon bonds here. Now we do have hydrogen binding sites. Again, we have our oxygen, nitrogen, and fluorine. But we also have a lot of carbon-carbon and hydrocarbon bonds. So is this hydrophilic or hydrophobic? So remember, this is fluoxetine, trade name Prozac. So is it hydrophilic or hydrophobic? Well, again, is Prozac designed to be targeting? It's supposed to target the brain, right? It's supposed to be a selective serotonin reuptake inhibitor. Serotonin is a neurotransmitter, so again, it's trying to affect the brain. Now remember, we have that blood-brain barrier. So even though my rules don't really help you in this case, because we know it's Prozac and it's supposed to be a psychoactive drug, therefore this is or actually hydrophobic, because again it has to pass through that lipophilic, that hydrophobic blood-brain barrier. So this fluoxetine has to end up in neural tissue. Therefore, this compound is hydrophobic. So again, why am I talking so much about hydrophilicity and hydrophobicity? It has major implications on how a drug lasts in the body, where it's able to go, and how long it is until it's excreted. So again, here you have things like THC and fluoxetine. They're hydrophobic, so they tend to accumulate in the fatty tissues of the body. So this is why things like THC and fluoxetine also tend to last longer and can also be detected in the system longer than versus a hydrophilic water-soluble drug. So something like THC can last in the body for months and can be detected in metabolites versus something like caffeine. Caffeine has a short half-life, is water-soluble. This is why you can drink an espresso in the morning and not feel it later on and the next day when you're up for 3 days in a row just from drinking one cup of coffee. Caffeine, very water soluble, very easily filtered into your urine and excreted through urine. Whereas hydrophobic compounds like THC and fluoxetine, well, think about it like washing your dishes. So say you have a very greasy pan, can you just get rid of all the grease by just running water over it continually? No, you need something, you will dissolve a very tiny fraction of it, but again, over time, it needs something else like a detergent or something else to get rid of those fatty compounds from that dish pan. Same thing with hydrophobic drugs. They tend to last longer in the body. And so hydrophobic properties not only have important implications for half-life and duration of a drug's effects and how long the metabolites last in the body, it also has important implications, especially if you have a patient that's morbidly obese or has a high body fat percentage. So the thing is that these hydrophobic drugs tend to accumulate in white adipose tissue because it's very fatty. So when you have all these hydrophobic compounds, well, say you have a patient with a high body fat percentage versus a patient with very little fat, even if they have the same mass, what happens if you give the same dose of drugs? Well, the thing is that about hydrophobic drugs, yeah, even if you're targeting the brain, nothing is stopping those drugs from actually being absorbed into white adipose tissue. Therefore, a patient with a higher body fat percentage might actually need a higher dose of this drug. And now, again, this compounds with the fact that these drugs last longer in the body. Say you want to take a psychiatric patient who has a lot high body fat percentage off of these drugs. These drugs are still going to be in their system because, again, it's very hard to flush these drugs out of adipose tissue. This is why hydrophobic and hydrophilic properties of drugs are very important.